How to relieve ingrown toenail pain. An ingrown toenail is painful, but luckily it usually isn't serious. It occurs when the side of your nail grows into the skin of your toe. Most of the time you can take care of it yourself at home. However, if it is severely infected, or if you have diabetes or another condition that reduces blood flow to your feet, then you should see a doctor. Method 1: Treating an ingrown toenail at home. 1. Identify the ingrown toenail. Ingrown toenails are most common on the big toe, but can also occur on other toes. If you have one, you will likely notice redness in the skin around the edge of the nail, swelling of the skin near where the nail is poking into it, pain in your toe. It may hurt when you walk or put pressure on it, fluid building up around the toe, an overgrowth of skin around the area, bleeding, white or yellow pus. 2. Take painkillers. Over-the-counter painkillers are usually effective against the soreness and inflammation of an ingrown toenail. Be sure you follow the instructions on the package. Talk to your doctor if you're taking other medications, since you want to be sure they don't interact with one another. If you happen to be pregnant or nursing, or if you're treating a child, be sure you talk to your doctor, since you might need different options. There are several options you can try, and they're all available at most stores. Acetaminophen, Tylenol, ibuprofen, Advil, Motrin IB, naproxen sodium, Aleve. 3. Soak your foot. This will help to soften the nail and surrounding skin, and lessen the pain and swelling. Afterwards your toe should feel less sore. Dry it thoroughly with a clean towel. Use warm water. It should be comfortable and relaxing to put your feet in. If it is uncomfortable, it is too hot. Soak for approximately 15 to 20 minutes up to 4 times per day. If you are unable to do it 4 times per day, soaking once in the morning and again in the evening will still help. 4. Push the skin away from the nail gently. After you have softened the nail and skin, you can gently push the skin back from the nail to help the nail grow above the skin, rather than into it. Make sure your hands are clean when you touch it so that you don't introduce dirt or bacteria into it. You can slip a tiny bit of clean cotton or dental floss under the nail to hold it above the skin. The toe may be tender, but it should not be extremely painful. 5. Protect the toe. After you have soaked and cleaned the toe, you can protect it from getting infected by smearing antibiotic cream on the area that hurts. Make sure you read the directions on the packaging before you use it. You can purchase an antibiotic cream over the counter at your local drug store. Bandage the toe. This will help keep it clean and prevent dirt and bacteria from getting into it. Each time you soak your toe, you should put a new bandage on. This is particularly important if you wear open-toed shoes. Method 2: Seeking medical treatment. 1. See a doctor if you are at risk for developing complications. If the ingrown toenail becomes severely infected, it can spread to the bone in the toe. You should be checked by a doctor if the pain is severe, the toe is infected and oozing pus, the toe is red and the redness is spreading. This would suggest that the infection is spreading. You have diabetes or another condition that reduces the circulation in your feet. This makes it more difficult for your body to heal infections in your feet and increases your risk of complications. 2. Let the doctor lift your toenail. If the toenail is only a little bit ingrown, the doctor may gently lift it out to help it grow over, instead of into, the surrounding skin. The doctor may insert something underneath to hold the nail above the skin. This may be a small amount of cotton, dental floss, a small splint. 3. Allow the doctor to trim a severely ingrown toenail. If your toe is very red, painful, and oozing pus, the doctor may cut away the part of the nail that is digging into the skin and causing the infection. If the procedure is likely to be painful, the doctor may give you a shot of an anesthetic first. If the toe is infected, the doctor may also prescribe antibiotics. 4. Discuss a partial nail avulsion. This involves removing part of the nail and nail bed. This procedure would only be done if you have a history of recurring ingrown toenails. During this procedure, the doctor would remove part of the nail and the underlying nail bed. This would prevent the nail in that area from growing back. In a very severe case, the doctor might remove the whole nail. The doctor might do these procedures with a laser, a chemical called phenol, electricity, Small surgical cuts. Method 3: Preventing ingrown toenails. 1. Trim your toenails so they are straight. Curved nails are more likely to dig into the surrounding skin. Trim your toenails so they are even with the ends of your toes. If you trim them below the ends of your toes may press on the skin and cause the nail to grow into it. If a pedicurist or podiatrist trims your nails, ask them to trim them so they are straight. 2. Wear proper footwear. Don't wear shoes that are too tight or pinch. Shoes that pinch your toes may squeeze the nail into your skin. If you have a job that puts you at risk of toe injuries, wear steel-toed shoes. A toe injury can increase your risk of getting an ingrown toenail. Wear sandals in hot weather. If your feet are sweaty, the skin around your toes will be softer, making it easier for the toenail to dig into it. 3. Examine your feet each day. This is particularly important if you are vulnerable to recurring ingrown toenails. By inspecting your toes, you can catch an ingrown toenail as it starts. You can also quickly treat a fungal infection that might cause your toenail to get thicker or wider. If you have diabetes, your ingrown toenail may have trouble healing. Talk to your doctor to make sure you get it treated properly.